I'm Wes Lo. I'm the Chief Executive Officer for Halemakua Health Services. We're on Maui. Halemakua Health Services is the largest post-acute care provider in the county of Maui. We have about 350 long-term care beds, and we have a home health agency, and we have an adult day health agency. So yeah, we provide about 70% of the long-term care beds in the county of Maui. Okay, so Wailuku facility is probably about 50 years old. That's the old facility up in Wailuku. Just absolutely a gorgeous facility, but it certainly has some age on it right now. And I want to say probably about 35, 40 years ago, Kahului facility was built, and we've made some expansions here. But this is the newer of our two facilities. We're approximately 7 to 10 minutes apart from each other. So yeah, we've been here for a long time, and we keep on. We're a very mission-based organization. We really just want to make sure that we take care of our community's residents, so in post-acute care. I think from an entry-level situation, healthcare is a fabulous field. There are so many opportunities in healthcare, and I would tell them to think seriously about it. I like to say that it's a great start into a career to actually see a future that you can earn a living wage. We kind of coined the phrase, sometimes it's better to try to see if you can get entry level in healthcare rather than flipping burgers at a fast food chain, because there's opportunity to advance and continue on. Also, I think you got to think healthcare is not only direct patient care. There's so many different opportunities in healthcare. You can be in direct patient care, you can be a nurse, you can be a physician, et cetera, and there's tremendous opportunities there. But there's a lot of clerical positions, a lot of office positions, there's a lot of technology positions, and the more you understand the whole healthcare realm, I think the opportunities are just amazing as long as you have the right attitude and really want to be part of a mission as opposed to working for money. I think it's a really rewarding career. So I think that the sky's the limit, and I think that it's a growing industry. It's not that controversial. It doesn't have a lot of the things, whether it's the telescope or GMO or anything like that. I mean, it's something that it's about doing the right thing for the community. I do this job because it is the closest I can get to actually saving a person's life. I wish I could do what the doctors and nurses do. I can't. I don't have those skills. I faint when I see blood and stuff. But by being part of this industry, to see the effect and impact on people is really important. And I think that's when we interview people, we want to see that they're interested in that and that it really means something to them. I mean, that there's some connection to it. It's not just going to be a job. It's something that they're saying is, wow, I can really be part of, helping somebody, helping a community, helping friends. I think that's probably, that attitude is one of the most important things I look for when we interview people, that they really want to be in this field. And it's not just about the money. It's, the money will be there, I think, in this field, but it's about the mission of the job. My favorite thing is being able to help somebody. One of the great stories, and so you can hear it from the perspective of not a direct patient care person. I had a friend of mine, younger than me, that had some terrible pain in his back in his shoulder, and it was pretty high. And he went to the doctor, and the doctor said, "You better go to the emergency room right away." And of course, my friend decided to go back to the office. He had a very important job. Went back to the office and drove himself to the hospital. They got him onto the cath lab, as we call it, and they were doing an angiogram. And the doctor asked him, he remembered telling me, he said, the doctor asked, well, are you having pain? And he goes, yeah, I'm having some tremendous pain in my shoulder, back shoulder. And he said, on a scale of 1 to 10, that's a typical question you ask. How high is the pain? He goes, I'd say probably about 11 right now. And they got the catheter in there, and he had a blockage, 99% blockage, and was basically having a heart attack on the table. and they had to put in what they call a balloon pump in just to get him to the floor above, to the operating room to have open heart surgery. Now the reason that was so rewarding to me is probably 2 years prior to that, we had no open heart surgery program. We had no invasive heart program. And so if you had a heart attack here, you would have to be flown to Oahu. And for me to think that a friend, dear friend of mine, if we didn't have that heart program, which I clinically was not involved with, that he probably would not have made it to Honolulu. I mean, think about it. They couldn't even get him up one floor without having to do a very invasive, put in what they call a balloon pump in just to make sure that your heart can continue pumping. It was pretty amazing. And he was discharged from the hospital 3 days later after open heart surgery. And the story I tell you is that he did complain about the hospital. He said he wanted a hairdresser at the hospital because he needed to wash his hair after 3 days of sitting in a hospital bed. But I think that when you see things like that, or you see a person with a stroke actually wake up on the table, it changes your life. It's really chicken skin. You can't believe that there's somebody alive because of something that you had something to do with, maybe not direct hands-on. And I think that is the reward to the healthcare worker, and I think anybody would just relish the ability to do that. Again, I liken it a little bit to education. When you see somebody from a broken family, etc., and they become some famous person, I mean that is a reward that you can't get in any job. So I think that's why I like healthcare so much. Yeah. In the post-acute care setting, to know that your kupuna are taken care of, and are that I see some great things they do over here on a May Day. They're having some people in wheelchairs doing hula, to stop the loneliness that's associated with long-term care. That's probably the most heartwarming thing, and to do something for people. It's sort of the random act of kindness, we're doing this and because it's our mission. It's not because we're trying to make money on it. I think that is absolutely the most important thing, and I think that it's underrated, the mission. I think, you and I have been around for a while, and those kinds of things mean more to you, right, than that paycheck. And I think that's important. I think there's certainly one of the harder parts is the emotional aspect of things. Is when you're sick, things aren't going well, and you can't always have the perfect outcome, and it's hard, and it's hard to face that and see that day in and day out. I think we've all lost somebody close to us, and you have to be able to handle that. But then it is offset by the rewards. I think the fact that people count on you so much here does put a lot of stress and strain on you. You need to be there for them, and whether there's enough people there or not, we still got to take care of the people. And so I think that's why we're here talking about the healthcare jobs here, is because we need to have enough people to really take care of a community, because we're going to do it anyway. And that's just the people that work in healthcare. There is no boundaries on the time and effort they spend, because they know they got to do it, and so there's a lot of responsibility in that. So I think that's hard, but also for anything to be rewarding, typically it is hard, and so I think that's something you just need to get used to. I do think that. Sounds like I'm sure a lot of people have been caregivers themselves. You need to take care of yourself too. You can't always be giving. You need to make sure that you have time for yourself, and that it doesn't become totally engulfed in this, because I think our goal is to have more healthcare workers rather than people leaving the industry because they're burnt out on it. So I think that's important. You got to make sure you set your boundaries too on yourself. Well, so as with any, for probably all employers, I don't care what industry you're in, I think attitude is definitely important. Need to be respectful, need to listen and learn, I think are some really critical things. I think in the healthcare industry, I think I mentioned, it's very important we have people that can think on their feet, have cognitive skills, are completely ethical and honest. And let me expand a little bit on that. In healthcare, in all of life, we make mistakes. And what I like to tell people, it's okay to make a mistake. It's not okay to hide a mistake, because all of a sudden you have more things that are counting on your efforts. And so I think that integrity is important, the respect, the willingness to learn and listen and to always learn is critical. And I think because this is a people industry, either in the patients you deal with the other coworkers you deal with, or the community, that you need to understand that there's always different points of view, and you need to be able to manage it respectfully. And I think that'll get you all kinds of places, as opposed to arguing with people or disputing things. I think you just need to come with an open mind and understand that there's always different points of view. I think gone are the days where we are expecting people to come into a job and work in that job for 35 years. I think that people coming into employment should be looking for jobs that will embrace their moving on and improving themselves. And the reason I say that is I think that employers will then find a bigger pipeline, because they are trying to encourage their people to learn more and become all that they can be, and whether it's with that organization or not. I think that you need to create that pipeline. So I think that's an important distinction. But coming into an industry is like healthcare. You start at an entry level. I actually think it puts you ahead of a lot of people that come in not at an entry level, because you learned why you're doing what you're doing. Our entry-level position is typically something like a certified nurse aide, and you start learning about patient care. You put in 2 years there, you could decide to stay on in patient care. You could become, we're trying to start an apprenticeship program for licensed practical nurses. And some people, in order to become an RN at a hospital, you need to become a CNA someplace. So sometimes we hire RNs to be CNAs here, because the RN needs to know what a CNA does, because CNA spends time. But then after that, so you have this opportunity to move forward in the clinical aspect of things. But let's say that that's not your cup of tea. I mean, you can go into medical coding. You understand the terminology. You understand why you're billing the way you're doing it, because of there are some clinical things you're doing. You could go into IT. You could go into administration, you could go into just a whole litany of different things. And the more you learn about healthcare, the more opportunities there's going to be for you. So I don't think there's any pigeonholing in healthcare. I do advise that employees look for an organization that is going to provide the training and the ability to advance, if that's what they want. I mean, because otherwise you don't want people that are just going to be doing their job and you want people to be engaged in their job. Every single person that works at a healthcare facility has an impact on patient care, bar none. Every single person does, and you want to make sure they understand that and that they learn and can continue to progress in their career. It's important to learn all about healthcare, but then the landscape is changing so fast that there's so many more opportunities. Just got to think about it. I think more and more you'll see people taking care at home, home health, respite care, et cetera. So, yeah, I think you're going to see a lot of changes and a lot of technological things changing too.